www.healthcmi.com. Acupuncture Continuing Education Online. Today, a little bit about the treatment of digestion disturbances with traditional Chinese medicine, both acupuncture and herbs. One of our articles published online in the news department, simply go to healthcmi.com, click on news, covers the treatment of acute appendicitis with acupuncture and herbal medicine, wherein using acupuncture and herbal medicine, including drug therapy, of course, increases the drug therapy success rate. So this is done in a hospital setting because an acute appendicitis is a medical emergency. However, in some cases, there are non-operative treatments for acute appendicitis wherein it's not severe enough to go immediately into surgery. People are given antibiotics and other medications to control it, to see if they can treat it without surgical removal of the appendix. And there's a lot of research in the article at healthcmi.com on this topic. Visit the one published on February 10th, 2017 to learn more about the treatment of acute appendicitis with acupuncture and herbs. So we cover both the non-operative treatment of acute appendicitis in biomedicine in hospital situations and how that is emerging as one option. And now we see in traditional Chinese medicine hospitals how the integration of acupuncture and herbs increases the efficacy rate and also lowers the adverse effects rate. So the iatrogenic illnesses, by definition, are illnesses caused by medical intervention. So non-operative treatment for acute appendicitis, basically antibiotics primarily, have a 28.95% iatrogenic rate, whereas the addition of acupuncture and herbs lowers that adverse effect rate, that iatrogenic illness rate, to 7.89%. That's very significant. And again, acupuncture and herbs increased the efficacy rate of drug therapy by 23.69% to almost a 95% total effective rate, which is extremely high. And they did that with a combination of some very simple acupuncture points: stomach 36, Zhusan Li, Lan Wei, an extra point special for that; large intestine 11, Chu Qi; stomach 37, Shang Ju Shu; and large intestine 4, a simple set of acupuncture points, and a very straightforward herbal formula based actually on an ancient herbal medicine formula dating all the way back to the Han Dynasty, Da Huang Mudan Tang. So that herbal formula combined with acupuncture and the drug therapy does produce results. So not always is it necessary in the case of an acute appendicitis to go for the surgery. Naturally, the surgery saves lives. There's no issue there. But what we are seeing now is in some milder cases that antibiotic therapy and other drugs are very effective, and now acupuncture and herbs enhance that. We cover some of that material, both ancient and modern, including modern research, in the continuing education course, Colitis, Crohn's disease, chronic appendicitis. That's the name of the course at healthcmi.com. So if you go to healthcmi.com and click on the Acupuncture CEUs link, you can see the continuing education course entitled Colitis, Crohn's disease, chronic appendicitis. And what happens is a lot of people, they really don't get acute appendicitis, but they get a lot of pain in the area of the appendix on and off. Even post-surgical pain, I might add, which is also interesting, which is really in the area of lower abdominal pain at that point, as opposed to appendicitis proper. So we cover a lot of that. That was authored by the great Professor Richard Liao, a licensed acupuncturist and MD from China. So take a look at that course at healthcmi.com. I think you'll enjoy that to learn more about that. And illnesses such as colitis and Crohn's disease as well are covered, and they're very stubborn illnesses. Take a look at the modern research and how that relates to some old treatments and some newer treatments. I think you'll find it very interesting, and it's so important to share this information because not as much in terms of hospital medicine in a medical emergency, which we're not seeing in the United States as much in terms of integration, but in terms of chronic illnesses, this has a lot to offer instead of someone being on kind of a chronic round of surgical interventions, chronic use of antibiotics, chronic use of steroidal and non-steroidal anti-inflammatories to control digestion disturbances. Sometimes we can get people away from that cycle and towards a cure. So how is this done? Think about an acupuncturist role. If someone's coming in with, let's say, a chronic case of colitis that's under control, maybe the patient is taking some steroids, maybe some other medications. But long term, those medications in and of themselves have some side effects. And obviously, if it's long term on those medications, they haven't cured the illness. An acupuncturist then uses some very simple protocols to introduce acupuncture and herbs into the treatment regimen. As the patient improves, so as they have less inflammation, as colonoscopies, as endoscopies and whatnot show that the patient is improving both objectively and subjective improvements in terms of less complaints, less blood and pus in the stool, better digestion, less loose stool and constipation, etc., then the acupuncturist encourages the doctor and the patient to work out a program to then reduce the medication slowly. None of this cold turkey stuff. A lot of people think, oh, I'll go see the acupuncturist, I'll take a few herbs, have a little acupuncture, and I'll just quit the drugs. That could lead to a medical emergency very quickly. It's not so radical an approach. Rather, patient may be on their medications, still having a lot of problems. And this is very severe because in many situations, patients with chronic digestion disturbances are afraid to even take a vacation or be far from a bathroom due to urgency of stool, for example. They can be in a lot of pain. It may interfere with sleep and lead to insomnia due to stomach dysfunction. There's a lot of problems associated with it. It's so important to help those people, and the acupuncture and herbs can slowly improve the symptomatic profile. Less constipation, less blood and pus in the stool, so many things. And again, the objective findings like the endoscopies can also show less inflammation in the intestines. And as that improves, then the doctor and the patient can work out a treatment reduction of the drug therapy. In the ideal situation, of course, patient is cured completely, they no longer need drugs, and eventually they no longer need acupuncture and herbs. Or perhaps it's a gray area somewhere in between. Maybe the patient simply has less symptoms and they can use less drugs. Maybe they don't need 2 or 3 medications. They can get it down to 1 or a lower dosage. Or maybe they need less acupuncture and herbs. So slowly weaning them away from medicine and towards a cure. That is more of the approach of a licensed acupuncturist. And I hope I shared a little bit of what a clinical paradigm looks for an acupuncturist. This is especially important with some illnesses that go chronic, such as colitis and Crohn's disease, but also in the case of chronic appendicitis. Visit healthcmi.com to learn more about that online course. And I'm grateful you had a chance to listen today. And if you like the podcast, go ahead in the iTunes store and leave a review. Let us know what you think. We'd like to hear from you. For healthcmi.com, thank you for listening.